great, but Sky's far up. But the high license so they can produce for a downwind cake loss. And clears from downwind haze. Finally, and we rolled over to the departure lane area. Oh dear. Rolled. Oh yeah, oh shit, there's no shit. With the Jeep, that thing. You got a motion here the August 8th, 2025 meeting of Beavercreek Rotary. I want to thank the creators, Amanda and David Hayes, Eric Marcus, the Ticketmaster. I would say Beth, but she's not here today. So she's usually here getting everything set up. And Pete Bales and Mark Weinstein and Michael Zwick for our programs. And Jim Gunville for the website. And it's 84 days to Halloween. I thought I'd have that. It's not hard to know. And Denny, you ready? For the invocation? Thank you, Dave. Well, good afternoon. On this beautiful August day, would you join me in prayer? So, Holy Creator, we stay focused on the objectives we have for the world: peace, tranquility, and the brotherhood of man. Freedom from hunger, from oppression, from sickness. Freedom to choose our own destinies. We affirm our commitment to our simple Rotary four-way test. So all we do to support is the truth. Is it fair to all concerned? Will it build the goodwill and better friendships? Will it be beneficial to all concerned? We are free to affirm our commitment to our high ethics in all we do, and we give thanks for the blessings, opportunities, and responsibilities that follow us as Rotaries. Amen. Amen. It's all the same. Thank you, Ned. Josh, you ready for a secretary report? Here today. It's a little flat. There were a lot. We're supposed to have a Sergeant Rock report, but yeah. Chris, I don't know where Chris is at. He wasn't there last week because he had to be gone for work, but I don't know where he's at today. So we should do the ticket drawing. Yep, might as well do that. It's interesting. You know, it costs. I don't know. I didn't get this. I feel that's it. Oh, so long. And the winning ticket is 826009. Whoop. Please. Sheriff. What is the next guy that bought a ticket machine so you can sure more? You got the card over there? That's my bad. See you back. This is that's the other. So unfortunately, let's go to our annual Christmas tax we do. Note 506. 5 euros? Yes, sir. Not that right. Is there any happy boots?
I'll give you one.
Oh,
I'm happy my wife's back out of the hospital. She seems to, I think she's got one of those little passports where you get a stamp for every emergency room you go to. But I'm happy that she's home and she's doing well.
Oh, good. Glad to hear that. Yeah.
For you. I actually have a gift for Shannon. Shannon, if you all know, headed up the RILA program for how many years, Shannon?
Several.
So this is not for all the years, it's only for the year that he helped me when I was your governor. There is a piece of a chocolate wheel on top here, but it's been in my car all morning. Very much, Eric.
No problem.
Yeah, I didn't see you over there.
With this smiling crew.
Yeah. All right, is there any announcements to be brought up for the club today? None?
Oh, I got one.
Okay.
Sorry. I was gonna wait because we don't have a lot of our new members in the room today. But if you're a new member within the last 2 years, as service project chair, we have a couple initiatives that we're getting ready to do. We were gonna have the new members kind of head up a couple of those, so if you could talk to me after the meeting, I'll kind of give you a heads up real quick.
Thank you. And Brian, are you ready, sir?
If you're ready,
I'm ready.
you're in charge and not me.
Who said that?
I did.
Thank you.
My friends, I'm pleased to introduce our presenter for the meeting today. We introduced Melissa Hastings. She has two degrees after her name, an MSW and an LISW-S, whatever that is. Perhaps she'll explain that to us. She's the Behavioral Health Education Liaison from Dayton Children's Hospital. Melissa graduated from the Wright State University with a degree in social work and then earned her master's in social work with a focus on children and mental health from UC. She's been with children since 2012. Melissa helped create the Mental Health Resource Connection Program. And I think I just saw something on TV about that recently, very recently. Governor was down and all that. I thought that was you. She helped create the Mental Health Resource Connection Program, which assists families in locating mental health resources for their children. Ladies and gentlemen, Melissa Hastings.
Everybody, thanks for having me today. I saw you had this slide with who your speaker is next week, and I may not look like the person who was supposed to be here, which is because I'm not. So Dr. Blankenship was scheduled to talk with you all, and she had something that arose with senior leadership. So I got asked to come, and I'm excited to be here. I do a lot of presentations in the community as a behavioral health education liaison, marketing our behavioral health line. So this is kind of in my wheelhouse, but Dr. Blankenship is wonderful. So I'm sure she is sad that she didn't get to come here and enjoy this wonderful lunch. So again, thanks for having me. I'm not sure what I did here to the slide here. Let's see if I can maybe
Let me get it up.
got to come back up here to get my
Wait.
show you forget. Okay. Yeah, so the LISW is a licensed independent social worker, Brian, for that information, for those who care about that. So anyway, the timing is great to have us out today because we are opening a new behavioral health center Wednesday. So if any of you have driven by on Route 4 next to the main hospital, you've seen this building. The beautiful thing about this building, oh, sorry. I said this slide, is that it brings all of our behavioral health services into one place for our families. So current state, if you're a family experiencing a mental health emergency and you have a child that comes to our crisis center is next to our emergency room in the lower level. If you need admitted to the hospital, you go up to the 4th floor of that building. And if you need a lower level of care, which is what we call day treatment at the hospital, you go over to First Street, which is about 1.5 miles away. So for families who are experiencing that in the midst of a crisis, it's pretty confusing. It's pretty common for families to go to the wrong location looking for a service. And it's just challenging. So I spend a lot of time in my role speaking with families, following up with families after they've had a crisis, just to get that feedback and really be able to kind of make some changes. So being able to bring everything into one area is really a gift for the families in the area. So we're really excited. So talk a little bit about, let's see here, this going. What was the trick to this? Where's my IT guy?
Trick.
On,
Maybe turning it on? Yeah, that might help.
turn on, tricks on.
Oh, yeah, here we go. Okay. There we go. All right, so this is our behavioral health strategic roadmap. We created this in 2020, really right at the height of COVID, or COVID was just kind of coming out and really became the mental health needs, I think, of kids in our community really became highlighted at that time. I've been working at Dayton Children since 2012 and have been acutely aware of the mental health kind of crisis that's been arising. But I think what COVID did is really highlighted that for the rest of the world. So for me, I'm like, yeah, this is really not surprising. But for the rest of the world, it kind of brought it to light. And the good thing about that is that money kind of followed that. So, we have the governor supporting us. Part of the building that, talking about here today, it was, funded by, a lot of that was funded through the governor's initiative. So very graciously happy and excited about that. These are what I call our buckets of care for our kind of service lines. So for those of you who are accessing or have children who might be accessing our care, we have outpatient services, we have our prevention and early intervention services. So these are some programs that we have in the school. We have something called On Our Sleeves. So if any of you have seen some of the billboard signs that have the kids with the tattoos kind of on their arms, I've got a slide here that will talk a little bit about that in a few minutes. We have outpatient therapy. We have 3 locations where we see kids for outpatient therapy. Those are in Beavercreek, Springboro, and Huber Heights. And then we have our crisis and emergency services, which again is going to be in this new building that's opening. And then we have an inpatient unit with 24 beds that will be expanding to 48 beds. So as that new building opens, we'll be doubling our capacity. And then we have kind of what we're calling our specialty program. So in there, we have an eating disorders program that is located in our South Campus building for kids who are struggling with eating disorders that are over the age of 10. And then we are also in partnership right now with Wright State University and Premier and Kettering, which, yes, I said Premier and Kettering. So those are exposing health systems, but they've come together on this initiative with the hospital and with Wright State to develop a college age intensive outpatient. So this is for kids who are in college, who are struggling, who need a higher level of care than outpatient therapy. To be able to attend this program in our area. So this is going to open in October. We're really excited about this. I've been sharing this with schools and colleges in the area, and people are really excited. So this will actually be located on the campus of Kettering's Kettering Behavioral Medicine Center on Lamb Road. So if any of you are familiar with that location, that's actually where this college IOP is what we're calling it will be held. This is just kind of another slide that shows the continuum of care. It talks kind of about where we have our services. So it became pretty evident to us that we really needed to go out into the community to be providing the services, not just at the hospital. So when we opened our inpatient unit, we really, what we found is that 1/3 of our kids that come to our crisis center get admitted, but 2/3 go home. So really the majority of kids do not stay at the hospital, they go home and they need a lower level of care, which is why we really looked at how can we reach these kids in other ways besides just building a behavioral health unit. We absolutely are expanding that, but we also need the day treatment. We need the intensive outpatient. We need the outpatient therapy because really that's where kids, if we can touch them at these lower levels of care, hopefully we can prevent additional crises and an additional need for a higher level of care. So we have social workers, crisis workers, counselors in what we call integrated care in our pediatrician offices. We have providers in some of our health clinics. We also do the outpatient therapy that I mentioned in those 3 locations. And then we also have, the crisis center and our day treatment. We also have something called a bridge clinic, which a lot of people, when I do this presentation, have never heard of. It's a service where kids come into the crisis center and they are not currently connected to a provider in the community. They don't already have a counselor. This clinic can see them up to 4 times with the intention to get connected to a provider in the community during that period of time. Right now, there's a state initiative that says that kids need to be seen within 7 days if they're in the emergency room for a behavioral health issue. And that's only happening about 38% of the time. So as a state, we're not doing well with that. So this initiative, this bridge clinic, kind of came about to address that need. And really is, trying to keep kids out of the crisis center and from coming back. So we've had 2 therapists in that clinic. We just hired a 3rd, and we have the capacity to just continuing adding people to that clinic as needed. We also extended the reach in that clinic to the adult emergency department. So if a kid, we were just seeing kids at Dayton Children's Crisis Center, but we wanted to reach out to people. Let's say the kid goes to Upper Valley Medical Center and is seen, or they go to any of Kettering's adult EDs. Kettering has 13 locations. So we piloted a program in February of this year where those hospitals, adult emergency departments, could make a referral to our bridge clinic if they had a child that is being seen there and they're not already connected to a provider. So that's also been a wonderful service that we've been able to provide to the community. This is the new building. So for those of you who haven't had the opportunity to drive by, we did a community open house June 9th. And I've had the opportunity to actually take quite a few people in the community through the building. We had a delay in opening. The building was actually supposed to open June 13th. And just due to some structural things that weren't quite finished, the building was delayed in opening. So we're actually opening this Wednesday. So August 13th. There's actually a few services that are in the building right now. We have day treatment that's currently in the building, and we have that bridge program that I was mentioning that sees the kids outpatient. The crisis center and the inpatient unit will move into that building this Wednesday. So really excited. Some other things that are kind of cool to highlight about the building is we will be able to cross-train staff amongst those programs. So when we have somebody that's off for medical leave or, quits or, something like that, we have turnover, we can move them. Every staff member will be trained in multiple departments so they can cover for people when they're out. Also just that seamless delivery of care for parents. So if a child is seen in the crisis center and they're referred to day treatment, the clinician will walk them over to the day treatment and say, here's where you're going to come tomorrow for that assessment. Hopefully they can even do what we call warm handoff, where they could actually even introduce them to the clinician that they would be seeing that next day, which would be really nice. Same thing if the child is admitted to the hospital and is going to be stepping down to the day treatment. Same kind of thing. We would walk them down and say, here's where you're going to come tomorrow for that day treatment program. And just a much nicer experience for families overall. We have a therapy dog in the building, which is a cool feature as well, and lots of outdoor spaces. So on the 2nd and 3rd floors where the inpatient units are located, there are outdoor spaces in the middle of the building that kids will be able to utilize when they're admitted to the unit, and also some outdoor spaces in the back of the building for the day treatment kids. Just kind of talks about our outpatient therapy. We have a location at South Campus. So for those of you familiar with that Austin Landing exit where those services are, we have an emergency center and some specialty programs there. Across the street from there, we open an outpatient center. So we have not only outpatient therapy at this building, but we also have a day treatment program. We have an intensive outpatient that will open September 3rd. Currently now, we also have an eating disorders clinic, and we have psychology and psychiatry. So lots of services at this building as well. One of the things when I was managing the mental health resource connection that was kind of cool is we have a lot of data. So, we see or work with about 5,000 families a year in that program. So part of the data that we use to determine where we are going to put additional locations is we look at zip code data for that program. And then we look at where are there already services that are currently in existence. So, for example, Huber Heights is a really good example of how we came to develop an outpatient program there as we looked at zip code data. That was a high referring zip code for mental health resource connection. It was also a high referring zip code for the crisis center, but it had the lowest percentage of counseling, outpatient counseling offices. Per capita in the area. So there was only two outpatient offices in Huber Heights, and one was a single provider. So not a lot of resources in that area. So what we're looking for is higher volume of kids that have a need and not as many services, right? So we want to put services in places where there's a need. So we are going to be starting another one of those studies in January. We'll be looking at, where do we go next, right? So one of the cool things about the hospital is we don't necessarily think we can do all of it, but we want to partner with people who can help us do it. So we're not do it, we want to partner in the community. So we have a lot of partnerships that we do that with as well. Oh, sorry, I did it the wrong way. This is the Honors Phase initiative that I spoke about a few minutes ago. It's just we partnered with Nationwide Children's. Nationwide Children's launched this, I think, in 2018. And Dayton Children's kind of joined this with them in 2021. We hired an outreach coordinator. She goes into schools. She trains teachers, they conversation cards for parents, they do a lot of outreach, and this is really falls in the prevention realm of things, because really what we're trying to do is how do you learn to communicate with your kids about mental health? How can you talk to your kids about mental health? It's okay to talk about mental health, really trying to reduce the stigma and kind of hit it on the front end versus the back end. So this is a really cool campaign to be a part of. And then this is just our developing our needed workforce. So we have 3 staff development coordinators at Dayton Children's. And because we are growing so rapidly in the behavioral health space, we need staff, right? So one of the challenges with the new unit opening is we will open the first 24 beds in August, right? But we have 48 beds, but we don't have the staff to open the additional 24 beds. They're not projecting that we will have that staff until January. We will probably need those beds before January. So we are hoping that we can open those before January, but it's going to be a challenge. So this is just one of the examples. We offer scholarships for therapists. They get additional money to do internships with Dayton Children's, and then they sign on to stay at Dayton Children's for a period of time after that, depending on the level of financial incentive that they sign up for. And we have partnerships with several local universities, Cedarville, Wright State, UC, just a couple. That's all I've got for you all. So I don't know if you guys have questions.
Well, I know what mental health is, but what is the exact definition of behavioral health?
The same. Yeah, so mental and behavioral are really kind of used synonymously. It's kind of funny, when I got into this field, it was mental health. And then I think because of the stigma, people started calling it behavioral. And now we're actually going back to mental health. So our building is called the Mattil Center for Mental Health and Wellness. So it's the same, to answer your question.
What's the common issues that would bring people in and be using a bed? What's the what type of problems are the most consistent?
Yeah, I would say most consistently it's anxiety and depression,
Anxiety, depression.
and what we call suicidal ideation. So that's where kids actually make a suicide attempt, or they have, they verbalize that they have a plan to do something like that. So yes, and that's actually a criteria for admission. So if you brought your child in who was experiencing what we call a crisis, they have to meet that criteria to be admitted. That's why really so many of them go home, because really when they do meet with the clinician, maybe they're depressed, but they don't have a plan for themselves. That's a child who would go home with some additional services, but not get admitted to the hospital. You have to be pretty severe to be admitted to the hospital. And again, luckily, we don't have, most of our kids do go home. But, when I talk about that need, I was actually just telling Lisa, usually summer is a lower time for us for the inpatient unit, because kids have a lot of anxiety related to school, and school's out for most of our kids, right, in the summer. This summer has been different. Our unit has been full almost the entire summer. We sent out a daily email to the emergency rooms just saying, hey, we've got beds, or we don't have beds, kind of to let them know starting each day. And we have been read pretty much every day of July. I got the email this morning, it was red, like what's happening. So it's really been kind of weird, because usually there is this cadence of volume, if you will, in terms of, usually Christmas is another time that the volume is usually lower, because, kids are out of school, it's holiday. there's usually just less of a need for those types of services during those times. And usually our staff sees a little bit of a respite during those times. We have not noticed that this summer, so it's been interesting.
How much of an influence is social media and the trends with social media and then the increase of intelligence?
A ton,
Okay.
yeah. I mean, there's tons of data I've done and research and books on that. I have 3 teenagers, so I'll just talk. I can talk about it just from my own experience with kids. Yeah, I think there's also something that I think is just this phenomenon of there's actually a lot of kids that actually kind of identify with their mental health diagnosis through social media. So, they actually, meet kids on there that also have anxiety, and there's this period of kind of like, oh, you have anxiety too. Okay, I also, I see you, right? But then there's also not this incentive to really get better, because then they identify themselves with that mental health issue. So it's really challenging for kids. Social media really magnifies all of this.
Have you seen any through lines this summer that gives you some sort of clue as to why it's been more difficult than past summers?
No, we actually haven't. I was actually just talking to Dr. Blankenship about this, because and I actually met with 2 schools. I did a lot of education with schools, and I met with 2 schools already. And actually just had this conversation with them that I actually want to follow back up with them once school starts and just see if they have been able to lay any insight into this with their students, just because I'm interested to know. I really not. I mean, we have seen what's been interesting with the legalization of marijuana. We've seen an increase of kids who are coming in with what we call marijuana-induced psychosis. So kids who abuse, they've got too much of the substance, and then they're really what we call they're hallucinating. They are, not well at all. And those kids actually, our length of stay on our inpatient unit is about 3 to 5 days. Those kids actually are kind of tipping the scale. They really need the 5 days almost. I mean, they're really staying the entire time, because it takes several days for that hallucination, their minds are really clear of the drug substance. So that's been kind of an interesting trend that we've noticed in the last year. But no, to answer your question, really haven't, but it's going to be interesting. So.
And what's the span of referral sources? I mean, obviously you can have parents or social workers or.
Sure, yeah, so anybody can refer to our outpatient therapy services. A parent can go online, a caregiver, and make a referral for those services. For the things like psychiatry, day treatment, those are usually required by a licensed clinical person or, a provider like a medical provider. We also have the Mental Health Resource Connection, though, which is a program that I helped manage and create, that we have social work staff that can help kind of facilitate those referrals. So I actually meant to bring some flyers. I told him I'm going to drop these off for you guys, so you can have them when you meet next week. But that's something you can hand out to families, or you guys can just keep on hand, where families can reach out and they can link them with any type of mental health services, either at Dayton Children's or even in the community. They look at where the child lives, they look at the insurance of the child, what they're looking for, and then they help get them linked to that appropriate service. So that's a really great resource, and they can help facilitate that referral if it is something that needs a referral.
You said that 38% of the people here in the state are supposed to visit within 7 days, but only 19% do. What is the reason for that?
So access. Yeah. So basically they can't get in with their behavioral health provider in that time. So even kids who are already what we call connected, meaning they already have a therapist that they see, we're finding out that they're not even getting back into that person in the 7 days. So let alone if you're a new patient trying to get it. Most of the time the barrier is that the wait lists are long. I was telling Lisa that our wait list for our outpatient therapy at the middle of May, we had 400 kids on wait list for the 3 locations. So it's pretty significant. So.
To begin with the numbers, it's proof that your services are needed. Again, I wanted to thank you for what you guys are doing to set a benchmark to give realization that mental health is an issue. and it needs to be taken care of. I'm a firm believer in that. When you take care of mental health at a young age, we have a better society. They've had much time with this guy up here. And so, as you guys are developing your program, you said drugs were in effect, but is there something as individuals that you guys are seeing can we do to help? Because again, the old school method was mom walk up to you and say, "Oh, cheer up, cheer up. There's nothing wrong with you." That's not how depression works. You know what I'm saying? And so, as everybody's more educated and we understand better, is there something we could do to help our youth be more mentally healthy?
Yeah, I think the On Our Sleeves initiative is great. There's also something called Youth Mental Health First Aid that we have, where we do a training. It's like an 8-hour training where you get certified in what we call Youth Mental Health First Aid. And one of the things they teach in that is that there's been studies done that if there's a youth feel person in their life that they can reach out to in need. It's like a significant increase in their ability to kind of cope with issues that come up or, be at less risk of, a mental health crisis occurring. So it just speaks to that could be a neighbor, that could be somebody from church, a friend. It doesn't have to be, a family member would be great, but not everybody has family that supports them in that way. So it really just encourages them to be that adult in a youth's life. Yeah. And, it's a great message. I always think, I always forget this gentleman's name, but he spoke at, he basically he jumped off the Golden Gate Bridge and survived. And you can look him up on YouTube. I mean, he goes around now and talks about and immediately when he jumped, he had this realization that he regretted it immediately. So now he goes around and speaks to youth about reaching out. But what's interesting to this is that he actually encountered a woman on the train prior to jumping. And, he basically says that he reached out to her. She actually asked him to take her picture on the bridge. And, he was crying and she didn't say anything about like, why are you upset or what's going on? She basically just asked him to take her picture. She was a tourist. And he says, like, I feel like if that woman would have said something to me like, hey, are you okay? What's going on? Something I could do for you. And again, this was a stranger. So, I mean, that's challenging to reach out to someone in that way that you don't know. But it's just, to me, it is a strong message that we do have the ability to influence people in ways that I'm not even sure we're fully aware of, and especially people that we have relationships with. So I think that's a good message. Sounds good.
If a mental health counselor pink slips with one of their kids, first of all, what's that age? Under what age?
So the pink slip's interesting because really parents have the full say. We can't really hold a youth there. We can make referrals to children's services. We can, notify law enforcement. But really, if a parent is not going to, agree to keep the youth there, we can't really hold the youth there at a pink slip like we can with an adult. So it's a little bit of a different scenario. We have that come up with schools where student resource officers will bring kids in and things like that. Most of the time we can convince the parent why the child needs to be there and get them to cooperate with that. Occasionally we have situations where, again, we do have to notify law enforcement or children's services if a parent is not agreeable to that recommendation. Most of the time, we do try to arrive at a joint kind of agreement on the level of care that's being recommended. Yeah.
You mentioned there's an outpatient facility in Beavercreek, is that right?
Uh-huh.
Can you just describe that facility, its location and what the services?
Yeah, it's on North Fairfield Road. And I think I'm not sure, Lisa, if you got the address. I think it's like 14. Yeah, it is right across from St. Luke. Yep. And it's outpatient services and justice. So there's like physical therapy located there, lab, and then there's also 4 therapists in that location. It's different than that outpatient building at South Campus that has mini behavioral services. This just has outpatient therapists there. We're actually hoping to expand that location because of all the locations that I spoke about, it has the longest wait list because it only has 4 therapists. And we have over 10 therapists at Huber. We have over 10 therapists in Springbrook. So we just don't have space at Beavercreek. We can actually we have space to the back of the building, we have to add on to the back of the building. And that's what, we talked about, because honestly, Beaver Creek's a great location for people coming, from lots of directions. So, it does make sense to expand that location. I think that's gonna be an initiative that will happen.
One of the issues that I found in the adult behavioral health was access into the system initially. And that it was very difficult for someone to even get started. And you'd call and they'd say, well, we can give you an appointment, and you'd call in July and they could take you in December. And what's being done at your program to shorten that access time so that someone can get treatment as they need it, as opposed to, waiting 3 or 4 months to get an appointment?
Yeah, so that program that I was talking about, the Mental Health Resource Connection, that's exactly what they do. So they will look at, is there a program at Dayton Children's? If someone calls in looking for a program at Dayton Children's, they will talk to them about that program. They will also look in the community, and they will give the parent the choice to either go on our waiting list and how long that would be, versus I can also give you the name of 3 counselors that would be up the street from you that you also could reach out to in the meantime. I would say the average length of time it takes to get into a counselor, if you're just looking for someone in the community, is probably about 3 to 4 weeks. That's probably an average time frame. Sometimes you will find an agency where we've got a new provider that just started and they have great access, and you just happen to kind of fall into like somebody's got great availability. I would say the bigger challenge we have with parents is they want the after school appointment. They want, a certain day or time, and that is more challenging. So if you have a parent who says, I can only go after 5 o'clock on Wednesday night, we're gonna have a harder time finding a provider. But overall, if parents have at least some flexibility, what I would always tell parents is at least offer some flexibility on the front end. Once you get in and start seeing the counselor, you can get into those later time slot appointments. But it's hard for parents. I mean, they're working, they're having to miss work. I feel like what I see most often is they just don't take the child as consistently as the child really needs to go, because they have to pick and choose how often they can actually miss work or get them there. So kids are going maybe every 2 weeks to counseling, or every 3 weeks, or it's also a financial issue. Sometimes they're paying very large copays every time they go, and they're having to pick and choose that too.
How long does Medicare allow a child to be in hospital?
So Medicaid is actually pays pretty well for our kids.
They do.
Yeah. So there's not a cap on the length of stay for the hospitalization. And as long as it's medically, indicated, they can stay as long as they need to. Mhm. Yeah, private insurances are actually the bigger challenge.
Really?
Yeah. Yeah.
Are a lot of your patients, children with ADHD, or are you deal with more serious?
I would say for outpatient, absolutely. ADHD, and usually ADHD is sometimes accompanied with other diagnoses like anxiety or depression. A lot of times with kids with strict ADHD or only ADHD, just see our psychiatry for the medication management, because actually medication, when it's managed well, actually treats ADHD very well. Not that counseling isn't also helpful, but I feel like most of the kids, if they're on a good medication that's working, and sometimes that's even done by the family doctor. It doesn't even have to be a psychiatrist. So, I feel like the ADHD, yes, it is something we see, but I would say we typically see it accompanied with another diagnosis. Or if the medication, let's say the family doctor has put them on a medicine that's not worked, maybe they tried a couple, the kid's losing weight, other things are happening, and then they now want a psychiatrist to weigh in and maybe make a recommendation at that point.
This is actually a question time. So in the adult region of mental health, people go through their psychosis or whatever their episodes are. They go and get medicated, sometimes forcibly, take their medication, and then they do like we all do in this room.
Get better and
I'm better. I don't
Yeah.
need my medicine anymore. You know what I'm saying? And so, is there a way, or is there a thought about, testing or something, or some type of regulatory thing that says you've been identified as this? We know that is going to lead to very dark, bad places. So, how do you ensure that they stay properly medicated?
Yeah, wow.
You know what I'm saying? I know, that's.
Yeah, no, it's a great question. I think, I'm thinking a few things. I was thinking, actually, my mind was going to something for genotype testing, which we do at the hospital, which actually is a panel of genetic testing. It's a cheek swab that they do with kids, and it actually tells the provider what medicine we're gonna do best on. So it's kind of a cool thing that's being done. I just want to mention it all to you because it is kind of cool. It basically says like, it has a green, yellow, and red system that basically says these are medicines that are going to do well, these are ones that are not going to do well. I will say, just as a clinician that's done this work for a long time, there's not any way to do that. I think giving the kids some choice in the matter is actually pretty helpful. And the fact that it does take medication, usually and therapy in a combination to produce the best results. So yeah, I wish there were, but can't make them take it. A lot of times they don't want to take it. And a lot of times there are side effects to the medicine. So there are legitimate reasons that they don't want to take it.
Right.
What's that?
Wouldn't you say though, in those cases, that a dedicated care provider, parent that is on the program will keep a kid going?
Oh, absolutely.
I mean, isn't that the essential part of it? If the parent is laissez-faire, the kid's gonna do what they want.
Yeah, absolutely. Yeah, absolutely.
And same in an adult situation.
Yeah, and I think kids will go through cycles where, they may go off their medicine for a while. And then I think kids are pretty intuitive. I think a lot of them realize, I actually probably was doing better on my medicine, maybe I should get back on that sort of thing. So I think it's just one of those things that, yeah, absolutely. And same with the therapy. I think the therapy, you have the therapist kind of in your corner about why this is helpful and kind of advocating for that as well, and will be helpful.
You had mentioned the mental health first aid, which I can tell you as an employer is such a valuable tool because they have it for adults, they have for which we put our staff through if they want to. But it helps us not just the services that we offer to the community, but then a number of times we've used it to our own staff.
Yes.
And whether they're teenagers or young adults, college age kids are having mental struggles. Is that something that you offer free?
So it is, yeah. So we could do that for you all. It's something we could do. We have and I can get you the contact with the person that runs that group. But yes, it is. And it is an awesome training. It's by Zoom, but you do some interactive stuff and it is just one of those things that after you're done, you're like, wow, that was pretty helpful. And like you said, in your own life, like I could be using these tools right now with my own kids or my own family, and it's helpful. So
He went through that bipolar with
Yeah.
our younger daughter. We ended up going to the probate court. And they shifted
yeah.
type of medicine she was taking to something that could be intravenous.
Oh, yeah. That's a great, yeah.
Yeah.
Yeah, that's a great idea. Yeah, so I think for adults, there are a lot more options because also there's just FDA has tested more things in adults than they have with the youth. So yeah, the longer acting things where they don't have to take the pill every day and that sort of thing, I think is a great option. The other thing I want to mention, I'm involved in an initiative right now with NAMI, which is the National Alliance of Mental Illness. They have family support groups that they run, and when the new building opens, we will be launching this. We will have we'll be opening it to the community. So we'll be doing family support groups on the unit. And these are going to start in September. So I don't have the flyer yet, but once I get the flyer, I can get that over to you guys. But this is something you could come to. You can hand out to your the companies you work with or things. But it's great. We right now offer a support group on the unit, but you have to have a patient on the unit or a child on the unit. So this is just an extension of that to be able to have those families come back if they need to. Or really, you don't have to have a child that's been on the unit. You could just have a child or a loved one that you're dealing with mental health issues with that you want support for. And we'll be doing that virtually and in person once a month. So.
I have one other question. I was recently made aware of a program for the female athletes.
Yes.
Is that your South?
That's at South Campus. Yep.
It's both the mind body,
Yes.
correct? So they deal with the mental aspects of
Yes.
the athlete and stuff.
Yeah, and it does kind of, I guess, accompany the eating disorder program. So a lot of times you have girls who might be struggling with body image issues, but it's not a full-blown eating disorder. So that's why we have that at South Campus, but it's a wonderful program. And again, if a child is referred to that program, it could also just be performance anxiety stuff that's happening with the sport. Or, but a lot of times it is those body image issues that you're just seeing kind of creep in early that you want to like try to nip and deal with. So if a child gets referred to eating disorders and they're really more appropriate for that program, we would help direct that or vice versa. Because those programs work pretty closely together.
Has there been any studies that you're aware of tying video games to kids? Violence?
I've actually seen some studies on violence in video games. I think it goes to the social media thing because kids, when COVID hit, obviously, I mean, and also the games now are very interactive. So they actually are with their friends on the video games. So it's like they're, gaming with their friends. So there's a very social aspect to the video games that's different than just being on a video game and not interacting. So I haven't read anything recently. It's a good question. I'm sure there are. I think it probably goes to the screen time question and how it's affecting mental health. There's more called the anxious generation. I would recommend it to anybody that wants kind of more information about this, but it has a lot of information in there about social media.
And I've been told about some kids that will not pay attention in school or can't pay attention in school, but they'll kill every zombie in sight. Just when they're getting
Yeah.
So they're
Yeah, absolutely.
that's very
Everybody.
just a second.
It is back to you.
Thank you very much.
Thank you. Thanks for having me.
All right, thank you very much. And in the past, tradition, we donate a book to the library that fits with our speaker. And Melissa's already signed this book. It's the Word Less book. That's right.
Yes,
But she's already signed this. And Beth, I think you picked another good one, like usual. And I'd like to get a picture with you, giving you this book here. But is there anything else to be brought up today?
In the Dragons game this weekend.
yes.
So if you bought tickets for the Rotary night, don't forget to use them. I know I bought mine so long ago, I forgot about it.
Oh,
Dragon game this week.
tomorrow, 7:05.
I had forgot about tickets for $100.
So I'm saying.
Well, thank you very much. I appreciate that. Great. Anybody else? Is y'all right for the pledge of allegiance, please?
Yes.
I pledge allegiance
To the flag, the faith, which is very well, which sustains one nation under God, indivisible.
Have fun, enjoy.
It's everyone.